So I'm now speaking to Dr. Ariane Sampson. Welcome, Ariane.
Thank you so much for having me.
Well, thank you for joining me. I'm just going to move on to your questions now. So, what demographics of patients do you treat?
So, as an orthodontist, I split my time between the NHS and private. And overall, I see mostly children under the age of 18, but about 15% of my patients are adult orthodontic patients.
Okay. And what challenges do you face related to implementing best practice for oral hygiene with these demographics with regards to orthodontic patients?
I think it's a struggle for a lot of people, particularly the younger patients, to maintain good oral hygiene when they've got a fixed brace on. And then with the hustle and bustle of going to school for them or going to work for the adults, it's very easy to forget a brushing in the morning or a brushing at night or a brushing after lunch and things like that. So it's really, really important for me to hammer home the importance of making sure you keep that oral hygiene routine 3 times a day. So that's been a little bit of a struggle, particularly when people's routines have kind of been thrown out the window with the pandemic, particularly for kids if they were learning from home and things like that, and for adults who are working from home. So trying to reinforce the importance of the routine, reinforce the importance of oral hygiene, that's been one of the biggest challenges. I think for kids also, people know that they want to brush for 2 minutes each time. When they actually brush, it's never for 2 minutes. They think, oh, I've been brushing for 5 minutes and it's been 25 seconds. So there's that also, that I'm trying to make sure that people are brushing for the full amount of time. And I very regularly go through specific parts of the brace where often people miss. So for me, as far as I see with a fixed brace, it's often across the gingival margin, so between the wire and between the gum, that a lot of people are missing.
Yeah. And how does Biomin fit into this?
Where I mentioned that a lot of people are missing when they're brushing, so at the gum margin, that's often where we see a lot of areas of demineralization. And that is a really awful risk of orthodontic treatment. You come out with beautiful straight teeth. It's just not worth it if you're going to have these areas of demineralization on the fronts of the teeth. So that's why it's really, really important to make sure we minimize those risks as much as possible. And one of the ways that we reduce the risk of demineralization is by promoting a toothpaste like Biomin that's really good for the remineralization, for reducing the risk of the white spot lesions after a debond of the brace. If we reduce that risk, not only do we debond the brace with a nicer result without the white spot lesions, but we also don't have to take the braces off early. If the oral hygiene continues to be a problem and the risk of demineralization is high, we have no choice but to take the braces off early. And I'd rather avoid that, particularly in orthodontic cases where we've had to take teeth out. So for those two reasons, using a toothpaste that's remineralizing like Biomin is really, really useful for us to make sure that we provide the best quality results in the healthiest possible way for orthodontic patients.
Yeah, thank you. And regarding white spot lesions and sensitivity, how and why should clinicians integrate a remineralizing protocol such as Biomin into their practice?
I think it's important to have this tool in your toolbox to minimize the risks of demineralization, to make sure that you debond the braces with the nicest result, that it's aesthetic. At the end of the day, orthodontic treatment is often an aesthetically driven treatment. And so you don't want to remove the braces and have a result that's not aesthetic. So demineralization is a part of that. So we want to make sure that we take the braces off with the nicest looking result, plus with the healthiest result. We've left the teeth in a straighter way, but also in a healthy way. There's no point in embarking on orthodontic treatment if we're going to leave the teeth in a less healthy state than when we began. So a toothpaste like Biomin really, really helps us with that. I find also, because I treat a younger cohort of patients, some of them are at an age where they're transitioning from a children's toothpaste to an adult toothpaste. And they find that transition quite challenging because they find the adult toothpaste really spicy. And that sometimes stops them from wanting to brush altogether, or makes them want to continue using a low fluoride toothpaste for their age. And so I find that the Biomin taste is not as spicy as a lot of the other adult toothpastes on the market. So it's a really good toothpaste to recommend for kids who are struggling with using adult toothpaste, and they tend to really like the taste of this toothpaste.
Yeah, I think it's such a relevant point, because the taste is key, really, for a lot of adoption of various different toothpastes, isn't it?
Even for older children, I find, if I've noticed that a lot of children with autism also have, they're very sensitive to the taste of the toothpaste. However, it's not necessarily because they're transitioning from a baby toothpaste. And so they find that this helps a lot also.
Yeah, such a good point. And how has the pandemic affected your approach to best practice and achieving the desired results for your patients?
The pandemic has meant that there was obviously the very long initial interval when we had to shut down our clinics in March 2020. So there was a long interval of treatment that was going ahead without any supervision. And then once we were back to treating patients again, because of the backlog, the intervals were longer than we would like. So all that lack of supervision means that oral health and oral hygiene is more important than ever. And so we had to kind of take a step back when we first opened our doors again, and go through the brushing technique again, go through where it was that people were missing around the brace, really reassess if there were signs of demineralization, because often in some of the patients there were, particularly where they lost that routine of brushing their teeth, and provide advice for how to reduce the early signs of demineralization, or to treat the areas of demineralization that had occurred. And so that was probably one of the most important points when we returned from the lockdown, and a big challenge to sort of reinstate the importance of oral health for these patients. And Biomin helped a lot with that, because we've been recommending it to the patients to improve the appearance of demineralization, and to prevent it in children who maybe struggled with the oral hygiene.
Yeah. And what are your thoughts on how optimized oral hygiene can be profitable to a practice?
Maintaining good oral health and producing good results with orthodontic treatment. I'm speaking from an orthodontic point of view.
Sure.
So with orthodontic treatment, if the patient has maintained good oral health and was supported with good oral hygiene, the gums are less inflamed, there's less risk of demineralization. It means that the visits for orthodontic adjustments are more comfortable, that after the adjustments, you don't have as much pain. And then after the orthodontic treatment is finished, you're left with a beautiful smile, not just with straight teeth, but with healthy teeth. And you're not leaving them with these white spot lesions that they then need treatment for, or that they suffer with sensitivity with. And that is economical for practices, because if you've got a well-supported, happy patient who's ended up with a good result, they're going to recommend their siblings, their cousins, their school friends, and things like that to you, because they appreciate the fact that you're looking after not just the straightness of their teeth, but the health of their teeth and the journey of orthodontic treatment, plus the aftermath of orthodontic treatment. And that in itself is always economical. You don't want to leave patients unhappy with the treatment. You want to protect yourself from a medical legal point of view, because at the end of the day, even though the demineralization is often a result of poor oral hygiene, the unhappy patient is going to be upset with you because perhaps you weren't monitoring it well enough or you didn't provide adequate support for it. So it helps to make sure from a medical legal perspective that you're offering them all the advice to give them the best tools to be able to look after their teeth and their brace.
Yeah. Thank you so much for what you've shared. It's been a pleasure speaking to you, and thanks for joining me.
Thank you for having me. It's been a pleasure.